This is a neural tension assessment for the radial nerve. So the radial nerve originates from C5 to T1. It exits through that posterior part of the brachial plexus, wraps around the posterior shoulder. It comes most superficial, sort of just distal to the deltoid tuberosity. It then continues around in between the brachialis and brachioradialis. It then splits into its sensory division and the motor division. So the motor division innervates all of the posterior muscles of the forearm extensors. The sensory division travels down and innervates the cutaneous area of the posterior part of these three fingers. Okay, so this neural entrapment through here can often happen at that posterior interosseous nerve where it dives in between or even through that supinator muscle and it wraps around that radial head. So it can often present with this heaviness and weakness through the forearm extensors. If it's more the sensory division that is impacted, then we're going to get this paresthesia and numbness through the dorsal aspect of those three fingers. So the way that we can assess this nerve is to have the patient hold onto their thumb. We want to apply or neutralize the shoulder. Okay, so from here we're going to go into a slight amount of depression, wrist flexion, elbow extension, and then we're looking to go into some shoulder abduction. So we should feel the neural tension wind up before the patient does. Okay, so we can use that as a flossing technique. Now, if we want to add a sensitizing addition, so increase the tension through that nerve, I could find that point of resistance and have my patient take her ear to her opposite shoulder. Okay, so that should increase the tension. If you come back to neutral and then to the same side, that could decrease the tension. And I can feel that through the tension of this nerve. So if we want to add that into more of a flossing movement, I could have you bring your ear to this shoulder as I go down and coming back to neutral and so on. So that's going to get that nerve gliding through that pathway. If there's any fascial adhesion or resistance through that nerve, it's going to help it to move a little bit better through that pathway. So give that one a try in combination with your soft tissue work to address where that nerve may be tethered.